today's discussion is health related, and we're going to talk about heart failure, which can be caused by a number of factors, and early detection is of paramount importance.
And for a better understanding, let's ask a cardiologist, Dr. Putri Sarah Saus from the MMC Hospital Jakarta. Good morning, Doc.
Morning, Doc.
Hi,
Morning.
thanks for
Thank
coming.
you for having me.
Thanks for coming. Now, for starters, maybe you can explain to us what's the difference between heart failure and a heart attack.
Okay, well, that is a good question. So, heart failure is a condition where your heart cannot pump properly, so that it won't distribute throughout your whole body. I bring my dummy here so that
Please.
I can explain more. So a heart consists of three parts, which is the first one would be the chambers of the heart, and it will help to pump up the blood throughout the body. And then the second one would be the arteries, where's the coronary artery, we call it. This is where it supplies the heart itself. And then the third one would be the heart rhythm, which is, it's the electricity that would help to contract the heart. So,
It's your heart beating.
The heart beating, yes. So to differentiate the heart failure from heart attack is where the heart failure, it's because of the pump itself having a problem, where the heart attack, it's because the cause is from the artery disease, from the blockage of the artery disease itself. So that's how you can differentiate it. And from there, you can see the symptoms also, which is different, where from the heart attack, it's because of the blockage, you have the symptoms of chest pain, and with perspiration also, and while from the heart failure, you have the symptoms of shortness of breath.
Oh, I see.
And you have a palpitation, and also you have a swelling from your foot, and then your abdomen, and sort of like that.
So a heart failure would be like the engine of the car just not working, whereas a heart attack would be like you're not getting the blood into the heart, like the blood is unable to flow. So it's basically you're not getting the fuel to where it needs to, right? A quick analogy of it.
Exactly.
Okay, so we do know that when it comes to heart attacks, some of the causes can be, for example, clogged arteries, things of that sort, right? What would be some of the causes or root causes of a heart failure then?
The causes is almost the same as a heart attack, but mostly it's because of, first one would be the blockage, or CAD we call it, coronary artery disease, and the second one would be because of the arrhythmia because of the electricity problem. And then there are other causes such as cardiomyopathy, which is the cause from usually it's unknown related, or sometimes cardiomyopathy from exercising. Athletes have that kind of, and also genetic. And then there's the other thing that is called myocarditis, which is lately it's been trending because of, usually it's because of the virus, but nowadays it's because of the vaccine. Side effect of the vaccine, as we know it, some of them cause that kind of myocarditis. And usually at that time, it was the vaccine called Pfizer that caused children in US proven that they can cause myocarditis for that.
Really?
So those are some of the reasons.
Some of the causes.
What was the third one again that you mentioned? The one that athletes can sometimes
cardiomyopathy, which is not all athletes though, because a lot of athletes can cause hypertrophy or the thicken of the ventricles or the chambers.
Right.
Yeah, but there is some kind of a genetic can cause
that as well.
Yeah,
that's actually kind of counterintuitive, because you would think that athletes would actually, that would be good for your heart, but it can actually be inversely in that condition,
I see.
right?
Yes.
Oh, wow.
All right. Now, I want to go back to heart failure. What are the biggest risks from heart failure, doctor?
Well, the biggest risk, you mean maybe by risk factors, okay. Yeah. So the risk factors for heart failure is hypertension. It's almost like all the heart disease itself. Hypertension, diabetes, cholesterol, And there is some kind of a family history, also genetic in a way. And then there's smoking. It's also causing, in the late onset would be heart failure.
Oh, I see.
Yeah.
Noted, well noted.
Right. So, you know, apart from, I mean, we don't want to wait until we get a shortness of breath or a heart attack or a heart failure or any kind of chest pain. Early detection, you mentioned, is key. So what are some of the symptoms that may show up before that we can kind of look at as red flags for us to at least do something about it before it reaches that point?
Okay, yeah. Of course, the symptoms like I previously stated could be you're having that shortness of breath.
Okay.
Usually while you are doing just a brisk walk, or sometimes you have a swelling in your foot. Both legs,
really?
though, not only one, but both legs, because if only one, that means that maybe there's a vascular disease also, as a differential diagnosis, sorry. And then...
why the feet? I guess because the blood's not flowing? Is that why?
Basically it's because of the pumping, it's not adequate, so that you won't give any adequate blood throughout the
pushing it enough.
Yes.
Pushing it through. Okay. So, how long do you have after you start seeing some of these symptoms before you actually reach a heart failure? Usually, like what kind of window are we looking at?
For that kind of things, we need to do, of course, another examination to really see if is it because of the heart failure or not. And the duration itself is, it's really related into what stage are you in. That's why we need
and the health of the person, I suppose, right?
And especially you need to do echocardiography, or it's like an ultrasound for the heart, just to see in what stage are you in. If you are in the first stage with the ejection fraction or the pumping, it's still good. That means that you are in the early first stage. Of course, from the symptoms you can see it, but of course you need a confirmation from the further examination.
Right, so it can vary depending on what kind of condition that you're in.
Yes.
All right. Now, I also want to know, doctor, about the lifestyle that may trigger this disease. What kind of lifestyle?
Okay. The lifestyle would be unhealthy, I would say. Like if you're not exercising well, it would cause obesity. And then if you're not eating right, too much sugar, especially nowadays.
Too much sugar.
Other than sugar, maybe junk food that we all love. Those are factors that can cause heart failure in the long run. Because it could cause a lot of the highest factors would be CAD or coronary artery disease that is caused by those food that we eat.
And it's a slow build-up, right?
Yes,
you eat junk food all the time, and then you start to clog your arteries. How about lack of sleep?
Lack of sleep, it could also trigger that. Usually, if we're lack of sleep, we tend to eat, binge eating, or
that's me. Whenever I'm sleepy, I look for food.
Whenever we do the morning show, it's sleepy.
Okay.
And that could cause lifestyle rather than, and then it came up into obesity, and then it goes forward into
it's like a chain reaction. Lead up, right?
So lifestyle modification is very important.
All right. So it's said that this is a more high risk for those in an advanced age, for example, 65 and above. Does that mean the younger you go, the less at risk you are? For example, children and young adults, are they at risk? If the risk level, rather, is either low or non-existent for children and young adults?
Not exactly. I forgot to mention that one of the risk factors is also congenital heart failure, which is a condition that is you inherited from.
It's hereditary.
Wow. Yes, it's hereditary. And then that condition alone already can cause. And then the other would be myocarditis from a virus, and that's why we have to really stay healthy.
So let me ask you then, Doc. If somebody is, let's say, there's a child, they have a history. The family has a history of heart failure. What are the triggers that a young person should avoid? Because we do know for something like cholesterol, that takes years to build up. Or is it more of a quick trigger if somebody has it, like if it's hereditary, if it runs in the family?
Not exactly. Especially young children nowadays, they eat. They don't watch. They don't watch their food or intake, right?
That's true.
Yeah, and a lot of a lot of junk food,
Like
a lot of
sugar.
sugar, and as we know that obesity, it's one of the problems in all over the world. So that's why I mean, health issues. It's mandatory to be managed in the young age.
Okay.
I see. All right. Now, I also want to know, doctor, what kind of treatment should people with heart failure take to prevent the disease from happening in the near future?
Okay, yeah. For heart failure patient, of course, there's medication nowadays, and the medication it's more advanced now. That we have a lot of in the last 5 years, there's this medication that can improve your longevity, and of course, heart failure cannot be cured, but it can be maintained.
Managed.
Yeah, it can be managed, and then the most important thing is that from that medication, we reduce the rehospitalization. Usually, they are prone to be hospitalized a lot, because of their condition, of course.
So this is more of a preventive measure. This medication
Yes.
will help reduce it at least. So let's say that heart failure has happened. Is surgery the likely course of correction or course of action to fix it or to save the person?
Okay, surgery would be, it really depends on the cause.
Okay.
If it's from CAD, of course, you have to fix that.
Okay.
Maybe by putting a stent, or maybe by bypass surgery.
Right.
But if it's already in the late stage of the heart failure and we cannot manage by medication, that means that we need to do transplantation, of course. But transplantation itself it's a difficult thing because there are a lot of factors that we have to look out for. And in the long run, even though they say that you can at least prolong their survival rate until 20 years, but the heart itself, it's from another person, right? So there could be a rejection from the person's body. Also.
Yeah, and I've heard that aside from the possibility of rejection, there is also basically an expiry date or a time limit that a body can use a different organ from somebody else, and we don't know how long or how short that can be, right? Because I have a brother that had a liver transplant, and it was accepted at first, but then after a while, he had to get another transplant because after a while, the body just wouldn't take to it anymore. And I guess those things can happen. So I want to ask you, Doc, if somebody has had heart failure and they've had to, let's say, have some sort of surgery or had been hospitalized, what are some of the after effects that they are likely to suffer afterwards? Can they fully recover, or will they likely have some sort of lasting damage to themselves that they'll have to live with?
Of course, it's a burden to a person who has a heart failure because they will have a rehospitalization often, but it really depends on how healthy he is. I mean, did he take the medication regularly? Did he exercise or not? That is most important because after all, exercise does improve longevity for the patient also.
Is it not dangerous for somebody who has had heart failure to do exercise, like at a risk of like stressing the heart too much?
Well, it really depends on what grade he's in, and especially before he went to exercising. Of course, we have to educate him first, and we have to see what level he's in, and then we can give him some pointers.
Adjust the exercise.
So you do like an assessment, and then you say, perhaps for you, don't do high intensity exercises because you have to kind of build it up slowly.
Okay. Now, doctor, also can you tell us about the first aid management for someone who is suffering from heart failure, and is it similar the first aid management with someone who has heart attack?
Well, it's different because from heart attack, it's because of the cause is because of the blockage, and that's why you gave nitrate. If you've ever heard of it, where you can put it inside of under your tongue. But for the heart failure patient, usually it's because of a lot of fluids in their lungs or in their body, throughout the body. That's why they need to use a medication called furosemide, where it helps them to urinate. So basically the water that retained can be excreted throughout the urine. Yes, and that's what they need the most if they have that symptoms. Because from chronic heart failure, it could become an acute one if they cannot maintain that one.
Okay.
Yes.
So you've mentioned some of the ways that we can avoid heart failure, or at least reduce the risk of heart failure and the way we should live our lives. But you know, it's always amazing to me. Like the heart is the one thing that never stops working, even though it works less while we sleep at night. Our eyes rest, our brains can rest, but the heart is the only thing that goes working throughout our whole entire lives. So what are perhaps some of the most important tips from you in order to keep this never-ending working machine to be able to work as long as possible in its best condition?
Okay, yeah. Well, not only for heart failure, but actually it's for overall the heart
health.
Where you have to live life modification, of course. It's exercising, starting from exercise. From the guidelines all over the world stated that you have to exercise at least 150 minutes in a week. That means if you divide it 3 times a week, that means 1 hour. But if you want to divide it into 30 minutes.
30 minutes is
30
enough.
30 minutes is enough, but 5 times a week.
Shanaz's heart must be very healthy.
I was about to say, you overtrained.
Okay, so exercise definitely is number one for heart
definitely.
health. Okay.
And then avoid the food that is causing that heart failure also.
Oh, okay.
Yeah.
Like fried food.
Yes.
Actually, it
fried
seems
food.
simple, but it's something that you need to do consistently over a long period of time in order for you to maintain that as well. All right. So, yeah, thank you so much, Doc, for your time.
Thank you.
Really appreciate the insight, and especially because you brought your little, because sometimes it's hard for us to imagine sometimes and visualize it. Doc, thank you again for joining us, and we hope that you and everyone else out there stays healthy as well.
Okay.